Hello, everyone, and welcome. We are so excited to have you here today for our UltraClear webinar with Weston Center for Plastic Surgery. We have a great presentation prepared to educate you all on our newest laser device. We'll explain how it works, what it treats, and why we're so excited. If you've been considering laser treatments or are curious about the latest advancements in aesthetic technology, today's session will give you a clear understanding of what makes UltraClear unique. We'll also reserve time at the end for a live Q&A with our wonderful speaker, Dr. Nathan Eberle. So please feel free to drop your questions into the Q&A box at the bottom of your Zoom screen as we go. If you experience any technical difficulties during the webinar, you can use the chat feature and I'll be here to support you. Be sure to stay with us through to the end. We'll be sharing a special UltraClear promotion available exclusively for attendees. Before we get started, let me introduce you to our wonderful speaker. I'm pleased to introduce Dr. Nathan Eberle, who is a double board certified plastic surgeon and medical director of Weston Center for Plastic Surgery in South Florida. With over 15 years of experience, he specializes in facial rejuvenation and advanced aesthetic procedures. Dr. Eberle's multidisciplinary surgical background gives him a unique perspective on facial anatomy and aesthetic outcomes. And now, Dr. Eberle, if you'd like to take it away.
Thank you, Holly. Well, I appreciate everybody attending tonight, and we'll try to make this educational. We're going to talk about anybody that knows me. I'm a longtime laser user, but recently started using UltraClear for some very distinct differences in qualities of this particular laser. So let's get into that. So I'm going to play some short videos throughout my presentation, some before and afters. We'll talk about the technology, and we'll roll through a lot of things. So let's get started with this short video.
The first of its kind, cold ablative fiber laser solution. The first device to give new life to all skin types. Finally, a way to treat every single patient. UltraClear, the first safe solution for sensitive skin, especially skin of color, optimized to individual needs. The cold and thermal energy of the optimal wavelength. Ablative resurfacing and 3D collagen remodeling in one pass, delivering each pulse to the exact same with precise timing, minimizing risk, allowing faster healing with optimal results, keeping patients safe from discomfort and side effects. Something they can count on every time, no matter what. Letting them get back to their day quickly and making sure they feel amazing when they leave. Be the first and move your practice forward. UltraClear, the clear choice to reverse the signs of aging for all skin types.
So you always got to love these promotional hype videos, but it's even more exciting when the device actually delivers. So let's talk about who's a candidate and who's not. There's plenty of patients that are not candidates for laser procedures, especially in South Florida. But with this particular device, it's a 2910 laser that uses a different type of technology, different than all the other lasers in the past, including my Cyton that I've had for years. The reality of it is the technology is just different. It's safe and effective to treat anybody, meaning all skin types. Could be a completely white Irishman, could be an African-American, anywhere, in the world, and you can still treat every one of those patients, and most lasers just can't do that. So what kind of things are we treating with UltraClear? We're chasing after uneven texture and tone, fine lines and wrinkles, acne and surgical scars, pigmentation concerns, photoaging, age spots, and overall skin rejuvenation, especially with advanced settings. With advanced laser technology, you really get more consistent results across all skin types and tones versus chemical peels and other things that are less well controlled. So, why patients ultimately choose UltraClear and why it's really become popular in the last couple of years as the device was launched and FDA approved. The 3D Miracle and things like UltraClear uses cold pulse technology to treat the skin in multiple different ways, multiple different layers, without using excessive amounts of heat. It's the heat from classically CO2, fractionated CO2 and erbium lasers that really are uncomfortable. And this technology is just different. You'll see in a little bit later, having hot pulses and cold pulses is what really allows this technology to work safely on all skin types. It's really an all-in-one solution. You can address multiple skin concerns in a single treatment session. The way that you do that is, from a practitioner standpoint, you can use advanced settings and core deep into the tissues at a known depth. You can then change it to a more moderate depth, and then you can change it to a third very superficial depth. So you can treat multiple layers of skin safely using multiple different modalities at one setting. It's quick. Quick being more superficial settings are very quick. It's like a 15-minute lunchtime type situation. The more advanced settings, clearly more time involved when you're treating multiple layers. Versatile, you can customize treatments depending on what the patient wants. You can treat the face, the neck, the hands, the chest. You can really treat just about anything depending on what you're trying to treat. So getting back to the skin types, for people that don't really know, we use this dermatologic classification system. Fitzpatrick type 1 would be, an ivory type skin, always freckles, sunburns. Again, think of that classic redhead from Ireland, all the way over to a type 6, deeply pigmented dark brown, dark brown, never freckles, never burns, always tans. Here in South Florida, a lot of 3, 4s, and 5s. So, having this laser technology helps out a lot to be able to treat a lot of different varieties of patients. Again, getting into the levels, we talk about here, superficial stratum corneum. For those of you who don't know anatomy, stratum corneum is the most superficial layer of our skin. That's what the 3D Miracle is treating superficially. You can basically do this treatment, and it's still an adjustable treatment, but you can, obtain an excellent result from a 15-minute treatment with very little downtime. Basically looks kind of like a sunburn for a short period of time. You can get into the UltraClear settings or ultra alone settings deep down into the epidermis, and you can cross into the dermis depending on how you have the laser set up. And then, of course, you can get down into the dermis and deep layers with laser coring technology, which we'll get into a little later. So the 3 levels of treatment, again, in the modes, you'll hear 3D Miracles, the trademark name. It's for overall skin health and glow, texture tone, photo aging, and pigments. You can see it's often young to middle-aged patients, minimal social downtime. You can use it to treat, again, all Fitzpatrick types, which is amazing. You get into the more moderate treatments, you can use UltraClear, Ultra treatments. Again, you're gonna jump deeper, so you're getting into the fine lines, wrinkles, deep wrinkles, acne scars, things like that. But you're also, just like any other laser, you start turning it up a little bit, going a little deeper, you are going to have a little bit more downtime, less downtime than more traditional fractionated CO2 or erbium lasers. You're in it for probably 3 to 5 days of realistic downtime. You can see this woman here as an example, middle-aged lady, fine lines, wrinkles, pigment, single treatment. We'll get into some of those more before and afters later. Advanced treatment, you're talking about UltraClear, you can really turn it up a little bit more, and then getting into laser coring. Your downtime now is probably in the more like 7 to 10 day range. And the skin types, the more aggressive you get, you do have to be more mindful of patients of color when treating them. So let's talk about laser resurfacing in general. Everybody talks about CO2. Nobody uses CO2 anymore. Some people use fractionated CO2, but nobody uses true CO2 anymore. That technology came about in the early 90s. Later in the mid 90s, ERG-YAG lasers came about. That's what my Cyton is. It's a dual fractionated. You get into the late 90s, non-ablative lasers. 2007, the IR fiber was initially invented, which is the technology that UltraClear is based upon. In 2018, they used that technology that was invented in 2007 and launched Aclaro. 2021, in December, it was first FDA cleared, launched in 2022. You can see what the initial FDA indications were: fine lines, wrinkles, age spots, scar vision, skin resurfacing, and then just in 2024, added some additional indications. So let's talk about what this IntelliPulse technology looks like. This is a little video kind of showing what this looks like. So with this technology, um, most of the other, all of the other lasers in the past, they just deliver heat. So regardless of how you set it up for a depth, you step on the gas pedal and it delivers a fixed amount of heat and depth. You can see with this technology, you get deep ablative in this depiction, but you're chasing heat pulses with cold pulses. And what that allows is it allows you to undergo the treatments with less pain, less downtime, and then also maximal results with those things. So it also aids in the healing faster, hence less downtime. And this is all adjustable. You can adjust the cold, obviously by me or whoever the practitioner is. You can adjust the coagulation settings from 1 to 9. You can turn it completely off if you have a patient that you don't think is going to handle any coagulation. Again, darker Fitzpatrick types aren't going to handle the coagulation like the lower ones, but then you can see a depiction of what the skin remodeling looks like. So after those microscopic holes are punched in the skin, you get neocollagenesis and tightening of the skin, which is the whole point of the laser. Another short video, this is kind of what it looks like while a treatment's happening. This is what the device looks like. It's a very friendly device. This is a woman undergoing a mild to moderate treatment. You can see the smoke evacuator, eyes are covered, but you can see that as the laser fires, she's not flinching, she's not sweating, she's not grimacing. You don't see her jaws clenched. It's very tolerable. Any laser and most lasers, you can change the grid patterns, but it's very common to see these different grid patterns on the face for a period of time. They go away relatively rapidly, except for when you're using coring and deeper strategies. But not that big of a deal. Again, you can see she's tolerating that procedure very well. No big deal. Here's a patient with a patient testimonial. Let me hit this play.
No pain, no recovery time. I was a little reddish pink, maybe for a day. And that was it. And the results were great. And this time, 2 passes, absolutely no pain. I can't wait to see this.
So when she refers to 2 passes, that gets back to whether we're treating superficial, moderate, or deep. As we go about those different layers, we make more passes based on the depth that we're treating in the skin itself. So let's get into some before and afters. These are one more video.
Introducing 3D Miracle, a 10-minute laser treatment that jumpstarts your skin's own natural renewal process. No discomfort, no downtime, dramatic results. It's safe for all skin tones. Visit 3dmiracle.com to learn more.
So as you can imagine, with the younger age groups, 20 to 30-year-olds, this has become a very, very popular treatment. So you can see this young lady, probably in her 20s. Texture, tone, glow, overall shine of her skin is fairly significant after one treatment, just a single month post-op. Another patient, I mean, nobody's going to argue with this, the difference in pigmentation that she has here, pre-laser through her nose, cheeks, mid-face, all the way down through her jowls and lower face. And it really cleaned it up well. Single treatment, 1 month post-op, pretty spectacular results. Another young lady, single treatment, 1 month post-op. Again, looking at fine lines, wrinkles. You're looking at texture, tone of the skin through the cheek, mid-face. Pretty significant results. Older woman, neck. We can all appreciate this in Florida. Probably pretty leathery skin situation here. Not really soft and supple. Single treatment, 5 weeks post-op. Pretty dramatic difference in cleanup there. Clear mode. This is, again, probably a Fitzpatrick 4 into a 5. Tolerated this well. Single treatment. She's only 5 days post-op. You can appreciate there's no redness. Things already looking significantly improved. Less pigment. You don't see any of this pigment here. All the texture and irregularity in her cheek and mid-face is significantly improved through here. She looks great for single treatment 5 days post-op. Again, getting into the heavier Fitzpatricks, the Fitzpatrick 6s. This young lady underwent 3 treatments. She's 1 month from her post-op from her 3rd treatment. And if you can appreciate the pre-laser here, look at the texture, tone, quality of her skin and the shine compared to post-op here. Skin just looks overall healthier. This one's pretty dramatic. This is a clear treatment. Patient underwent for this big pigmented lesion just lateral to her orbit. Single treatment, 6 weeks post-op here. 2 treatments, 4 months post-op. It's almost like an eraser. I don't think anybody would argue with that result. Looks great. A little bit more melasma type situation, clear. 10 months post-op, 2 treatments. Has a little bit of residual stuff, but overall significant improvement. Stuff that, at this point, very, very hard to probably flush out the final parts of that, but I'd be curious to see what a 3rd treatment might get the job completely finished. But she was happy after 2, and that was it. Other side, same thing, all the way up through her mid-face, her cheek, lower face, significant improvement just after 2 treatments. You can laser all parts of the body. So this is a hand. You look here beforehand, lots of pigmentation, definitely the aged appearance of a patient's hand that's probably in their 60s or 70s, really cleaned up the hand a lot. Far less pigmentation. Now that hand probably looks 15, 20 years younger. As we get into deeper treatments, these are more moderate treatments, ultra treatment. So treating the under eyes is a very common area to treat. So 5 weeks post 1 treatment, you look at the texture, tone, everything around the periocular area, significant improvement. Treatment of scars. So old scars, new scars, ideally newer scars, but can be older scars. Caucasians, we typically heal with a fairly pink scar. This one is a little bit hypertrophic or widened. Single treatment, 1 month post-op, took a bunch of the pigment out of that, so it blends into the adjacent skin a whole lot more. 2 months post 2 treatments, 4 months from the initial, looking really good. Has a little bit of pigment left in it, but by and large, that very white scar is going to blend in very well with the adjacent skin, which is the entire goal. UltraClear again, pretty dramatic here. Single treatment, 1 month post-op. You look at the pigmentation here through the cheeks, down through a perioral area, periocular area, same, significant improvement. Brown spots significantly improved all the way up to her forehead compared to the pre-op or pre-laser. 1 treatment, 2 months post-op. This is a customized treatment. So whenever we talk about customized treatments, you're talking about multiple passes. You're gonna go through the middle layer with the UltraClear settings and then dust the top with the 3D Miracle type settings. And that really, in a combination, can clean up a lot of stuff. If you look at all this pigmentation throughout her forehead or cheeks or lower jowl area. And then when you do jump into that moderate type treatment with 3 to 5 day downtime, it can really clean up the jowl areas. You get that neocollagenesis that can really get some nice skin tightening and changes for the skin, in addition to cleaning up the pigment on the outside. It's another great customized treatment, chasing after fine lines, wrinkles, all these things of the lower eyelid or periorbital area. Very clean result for a single treatment 4 weeks post-op. Another one, customized treatment through the cheek. Again, you can appreciate the pigment through her cheek, fine lines, wrinkles through here, kind of some laugh lines all the way through, and then post-laser, single treatment, 1 month post-op, looking pretty good. And that will likely continue to improve over the next couple weeks after that. Here's a patient, single treatment, UltraClear settings, 20 days post-op. Ice pick scars from acne, real problem to deal with. big brown spots, not so pretty. You know, post laser, big brown spots mostly gone. Ice pick scars significantly improved. Were they gone completely? No, but it was a single treatment. So, you know, put her back on the table, hit her again. You get through a couple of treatments for those deeper ice pick acne scars, they'll mostly resolve and go away. She even received a nice improvement down through her jowl, got rid of a bunch of the pigment that she had here and tightened and smoothed out her jawline there a little bit, which is nice. It's a pretty dramatic result of a neck. Funny as it is, I had a lady today, 72, that came in for a consult discussing a situation almost like this for a neck. She's kind of on the fence about a neck lift. She's in the healthcare world and not sure if she wants to undergo that recovery. I threw this one at her. Cervical skin laxity, clearly, in her pre-op. Lasers can't fix platysmal bands. Those are deep to the skin, but pretty dramatic result here on the post-op. You know, you can clearly see the skin's tightened up. All that crepiness that was down this lower third of the skin here is now tightened up. Hence, you can see both pillars of her muscle all the way down through. Now, she's 3 treatments, 1 month post-op, but pretty dramatic considering non-surgical. Another UltraClear treatment, single treatment, 1 month post-op, cleaned up a bunch of ice pick acne scarring through her cheeks, mid-face, pores of her nose. She looks good. UltraClear, multiple settings. This lady's in her 60s, pre, 1 treatment, 2 months post. Pretty significant. Wanted some more, didn't want surgery. 2 treatments, 1 month post. Pretty significant result from here to jump all the way over to here. Clearly wiped probably 10 years off for life with 2 laser treatments. Didn't even need a knife, just a laser. Again, getting back to scars, this cute little guy banged his forehead. He's clearly injury prone. Immediately got to it. Single treatment here, 2 treatments here, almost gone. He obviously has age on his side, and the parents were vigilant about undergoing treatment quickly, which is important with scars. The faster you get to them, the better. This was the lady that was on one of the previous screens. Lots of pigment through her cheeks, through her temple area. Single treatment, 5 weeks post-op. Cleared up most of her pigment. She's got a little left here. Probably clean that up a little bit later, but you can see nice and smooth through her periorbital area, perioral area, significant improvement. She looks good. Pretty dramatic result of a jawline with a moderate to deep treatment. You can appreciate here, she had a jowl that was hanging, some crepey skin up through here. And with a single treatment, 6 weeks post-op, you can see the neck is tightened up, the jawline tightened up. Looks good. Pigment, pigment, pigment. So pigments plus a lot of perioral lines and wrinkles. So hit her pretty hard through the perioral area, cleaned up most of her pigment on her cheeks, her nose, her forehead. Very dramatic result. She underwent 3 treatments and 3 months post-op, but again, she didn't have a knife put to her skin. That was a laser, so pretty dramatic. The final thing I'll get to tonight is the laser coring portion of this. So this is the only laser that is FDA approved and cores. What that means is going to be shown in this video. So with coring, I'm going to use the laser to deliver energy into the skin and effectively cut a core. So we can change the coring pattern a little bit, but this is what the laser is actually doing at the skin level. I can adjust the pattern, the depth, the percentage of coverage. What that means is how tight the circle is or how packed the circle is with energy. What this is doing is it's driving that energy down into the deeper layers of the skin. And as it drives that energy down the deeper areas of the skin, the body then is forced to heal inside out. And what that turns into is neocollagenesis. Fine lines and wrinkles mostly go away. It can combat some deep lines and wrinkles, overall skin tightening for the face and neck. So this young lady underwent multimodality, including laser coring. Again, you can appreciate down through her neck, up through her jowl, through her cheeks, up to her forehead. She had multimodality, neck skin significantly improved, tighter left to right, jawline, all the way through the jowl, marionette lines, nasolabial fold, significant improvement through here. And then obviously she was treated moderate and deep levels also. All the pigmentation changes up to her forehead and mid-face and cheeks look significantly better. Another laser coring treatment. This is only a single treatment, but 5 months post-op, significant improvement through the neck, left to right. Obviously, this patient would benefit from more treatments, but single treatment, you still get results, just not as dramatic as that other lady that had 3 treatments. Deep lines through the jowl, down through the neck. We've all seen some of these patients. They've lived, in Florida their whole life and can end up having some look like this. 6 weeks post single treatment, pretty dramatic. This is going to be laser coring, full ablative, a mixture of all depths of the skin to combat things like this. It's a legitimate 7 to 10 day downtime, but pretty dramatic results and no scalpel involved. Pretty phenomenal. Perioral, same thing. Appreciate all the texture and irregularities of the perioral area. Looks like she's been sipping on Diet Coke her whole life, and single treatment 6 weeks post-op, really significant improvement from her perioral area all the way around. More coring when we talk about the periocular area. Again, if you appreciate the texture tone of her inferior eyelid skin here versus post-op. She also had it done on the top. Looks significantly better. Nice and smooth. And that's what I have for you tonight. We covered a lot. I will answer any questions that we might have that came up during, but UltraClear is really a all-in-one solution for all things related to skin tightening, discoloration, aging, all the things. So I'm here to answer any questions at this point.
Yeah, that was fantastic. Before we jump into my favorite part of the evening, for everybody that was tuning in with us live today, we are offering 20% off of UltraClear packages. This is a limited time offer, so your packages do have to be purchased by September 1st. And the first 5 of you to get your treatments booked will also throw in complimentary 20 units of either Botox or Jeuveau. So it's a fantastic offer. You may be wondering, how do I book it? I will put a link in the chat here, so you guys can go ahead and fill that out. That'll go straight to our front desk team, and they will be in touch with you as soon as possible tomorrow so that we can get you guys booked for your treatment. So everybody should have received that in the chat, and we can go ahead and move into some Q&A. All right. A couple of them have already popped in. So remember, everybody, if you have any questions, feel free to pop them in the Q&A box now. This is your chance to ask them live. All right, so first question that came in, can you please tell us the difference with this laser and Halo as far as the recovery and collagen production?
Yeah, so Halo hybrid fractional laser, I've been using a Cyton with the Halo device for about 10 years. Halo, just like this device, some of it depends on how hot you're going to turn up the device. Biggest difference with this, again, at its core is that with the IntelliPulse technology, you're firing hot and cold. The erbium technology that's dual wavelength with Cyton is firing dual wavelengths, which is what the Halo is. But it's only using heat. There's no cold in there. The only cold that you're feeling when you undergo a Halo, unfortunately, is from the chiller. So downtime's typically, apples to apples. Downtime's a little more. If you're trying to achieve a similar result from Cyton versus this, your downtime's going to be a little more. You're not going to have as comfortable a treatment. It's going to be a little more painful going through it. Comparing them side by side, I don't know, maybe I'll convince my wife to split face and, we'll treat her with a Halo on one side and UltraClear on the other, but she's probably not going to sign up for that.
Awesome. Okay, next question. Can you give us any idea as far as how much this treatment costs?
Sure. So there's varying costs depending on time involved, right? So obviously, a 3D Miracle is going to be significantly less than if we're dealing with laser coring all the way up to, multiple layers and multiple surfaces, right? So a 3D Miracle treatment, which is an amazing treatment, could take 10 or 15 minutes, with a fairly minimal downtime. When you're going to laser core and then treat the middle layer and then treat the superficial layer at the end with a 3D Miracle, it's going to take 45 minutes or an hour. So obviously the price goes up based on where you're treating. If you're only treating the periocular area, it's going to be a pretty quick treatment, so it's not as expensive as treating the whole face. So it varies, but Shirley can absolutely answer all those questions for you about the various treatment costs involved in resurfacing, scar treatment, all those things. Most patients, I saw 2 patients today. One was a post-traumatic patient. She needs a combination of things. She's got some scars that didn't heal very well from a procedure performed at another plastic surgery office. So she's going to undergo some scar therapy for 3 sessions, but then she also has some melasma, some pigmentation, some things. So at her first treatment for her scar, she's going to undergo scar therapy, but then she's also going to undergo more of a moderate therapy to deal with the pigment. So it's really customizable in regards to cost.
Yeah, so come in for a consultation first,
Yeah.
and we'll assess your skin and come up with a personalized treatment plan for you.
Yeah, it's not an easy answer.
Let's see, can I purchase it now and have the treatment later in September? I think that's regarding the promo.
Yeah, I think Shirley would be happy to collect your money and schedule when it's convenient for you. Again, there's still some downtime, so it really boils down to when you have availability to have the procedure done.
Speaking of downtime, that was another one that popped in here. And obviously this will depend on the treatment plan and the modality for your session. Do I have to take time off of work, or can I just take 1 to 2 days?
Yeah, so for the more superficial treatments, the 3D Miracle, you're fine just going back to work. But it's kind of a loaded question also. This came up again with a patient today. It's social downtime. It's not, it's not you have a broken leg downtime and you're sitting at home. So some of it has to do with how comfortable you are in your own, no pun intended, your own skin and what you're willing to show off to the world. So for the lighter treatments, yeah, it's quick, easy. It's a 15-minute procedure. You're out the door. You can realistically go back to work. You look like you ate lunch outside and got a little bit of sunburn, but that's about it. You get into the deeper treatments, 3 to 5 days downtime. I call it a long weekend recovery. Again, it depends on if you're using some more aggressive settings and hitting some particular areas, maybe a little deeper than others. Could be more in that 5-day range. So it's a little bit more than that, but probably a long weekend at home, kind of hiding away, and then back to work, doing just fine socially. Laser coring and deeper treatments, downtime's shorter, but getting kind of similar to, my Cyton with erbium and other things. It's going to speed up the process a couple of days with the IntelliPulse technology, but the reality of it with lasers oftentimes is, big results, big downtime. It's less downtime with this, but it's still some downtime. So.
Awesome. And another one about booking. What days of the week can I book this service? Are you offering it any day of the week, or is it just certain days?
Yeah. So typically any day of the week. Could be Monday through Thursday. Office is typically not open seeing patients on Fridays, so it's typically Monday through Thursday. Most of these things will be booked in the afternoon unless it's a deep, complicated case that would require, or the patient would want some IV sedation or something. Then we're usually doing that kind of stuff in the morning.
Okay. Let's see. And then what is the best treatment for pigmentations from clogged pores? This attendee used to pluck hairs. Second question from part of that one is, can it remove any freckles or I always mess this word up. Seborrheic. Yes, you know exactly what I was talking about.
Yeah, so there was a great picture of seborrheic keratosis there. So yeah, you're talking about where those pigments are living, just like with if you have scarring from plucking and things like that. Those are at least medium layer treatments. You have to get down into the skin some to get enough neocollagenesis to get that skin to remodel. And then with the pigment, you got to get into the layer of the skin that actually is housing that pigment to break it apart. So yeah, you can treat those things. You're not talking about superficial layer, you're talking about in the middle layer. So a little bit more downtime. And with some of those things, as you saw, can definitely take a couple of treatments. It's not always a one and done. A lot of those melasma cases with a lot of pigment through the cheeks, single treatment wiped out, I don't know, 80-90% of it, which is an amazing result. But if your goal and endpoint is to try to eradicate all of it, yeah, it might take a second treatment.
Right. And do I need to prep my skin for before the laser? And what does the aftercare look like?
Yeah, so skin regimens are always a good idea. You should be taking care of your skin pre-laser, post-laser, all the things. Post-laser, again, it's a loaded question. If you're superficial, there's not a lot of skincare. If you're going into that moderate layer and for sure into the deeper layers with laser coring, it's going to be a little more involved. Could involve some, soaks on the face to help shed the skin, get the debris off, keep things clean, and then hydrating to keep the skin from drying out and getting superficially infected. But we have all that written out and we give it to you email, paper format, all things. It's pretty easy. And we make sure that we have you all set up beforehand and after with the correct skincare regimen so that you're not going to harm yourself and you're going to get optimal results. I have patients ask all the time, do I need skincare before or after? And I tell them, listen, I can prep your skin and cut through dirty layers of skin and get a decent result. However, wouldn't you want to, pre-wash your car, at least wipe the mud off before you completely wash it and then wax it? It makes a whole lot more sense to do the whole process if you're going to spend the money. Skincare does really work. You just have to use it.
Perfect. Let's see, a couple of questions coming in about Botox. Can you have this done if you have Botox or fillers in your face? And I like this one also. Will this wear off my Botox faster?
Yeah, so you can absolutely have laser treatments, any type of laser treatment done with Botox in your face. There's no studies that show that it, eradicates your Botox any faster. What was the second question, Holly? Can you?
Will it wear it off? Will it wear it off any faster? Or can you do it if you have it in your face currently?
Yeah, either one's fine.
Yeah, safe enough.
Either one's fine. You probably, you could inject and then laser. Ideally, probably not the same day, but you could, inject first and then go laser the skin afterwards. The Botox is getting injected, deep into the muscle layer. And as you saw in the videos, especially the 3D miracle type treatment, we're just dusting the outside. We're not even close to those layers. So.
Perfect. All right, back to melasma. Will it come back or can it be eradicated?
Hopefully it's eradicated for good, but with anything skin related, even myself, I developed some rosacea, as you can see on my forehead. I was not outside, sun tanning at noon, but I just developed some rosacea in my 40s. So, any dermatological thing can absolutely come up and or develop, at some point in your life. But most of these pigment things, usually when you blast them away with a laser, they could come back because you're prone to that particular, dermatological condition. They're not necessarily going to come back in the same place.
Perfect. Let's see. So can I do this laser if I've had a facelift?
Sure. You should. You should. The patients that have the overall best facial outcomes for aging patients, 50s, 60s, whatever, some now into their 40s. Yeah, you move the deep structures of the face around and get all that stuff nipped and tucked, and then have a good laser treatment that cleans up the rest of the skin and the siding. They absolutely have the best results.
Fantastic. Let's see. How long would I have to stay out of the sun after?
Loaded question. Ideally forever. Not realistic. We live in Florida, but for the bigger treatments, pretty critical in those first couple of weeks for sure. Basically, we're peeling back the layers of the onion, and it's like having baby skin. You don't put a newborn baby with fresh skin outside to get burned. They burn in within minutes, and your skin's going to be the same. So, I encourage once you get back to a more normal skincare routine, which is usually, with the bigger procedures, 10 to 14 days type of situation, you need to be using, sunscreens at that time too. Wear a hat, try to avoid it as best you can. But, those of us who live
Yes,
in
and
Florida, it is what it is.
protect your investment. Stay out of the sun a little bit.
Correct.
Awesome. Well, I think that's all the questions that we have for today. So thank you, everybody, for joining. Dr. Eberle, thank you. That was a fantastic session. I cannot wait to get my treatment done, and hope to see everybody in the office soon.
Perfect. Thanks, Holly. I appreciate it.